Few things. Cervical versus cranial isolation. If I drop the cranium down and up, I can get cranial motion on the cervical spine. We're not going to be assessing cranial motion in this particular section of classes. There is assessments you can do to isolate cranium versus cervical spine. But right now I'm just looking to lift the head and cervical spine to its end range again. So if we consider neutral to be 0 degrees, we are going for 70 degrees of range, which puts us, about 45 degrees. This puts us about 70 degrees. Josh can extend even further, but obviously we're pulling into erectors. If you have nice, healthy spinal extensors, you should feel all the way down to the sacrum. Right? No problem for Josh. Now, as far as cervical extension goes, there are a lot of people who are a fan of bridging. Right? Bridging is one way you can definitely assess the ability to extend the cervical spine. And what you'll feel with Josh is lower cervicals extend really well, mid cervicals not so much. There's a nice block in his C2, C3 if anybody wants to come feel that. Anybody want to come feel this block? So bring your fingers underneath. And I'll also show you an off the table assessment, but push up where you would imagine the cervical spine and thoracic spine to meet, so pretty low down, and just bridge up into space.
Kyle does that from like the shoulder blades.
Yeah, it's a great way to quickly assess spinal extension.
When
Now,
you're saying a block, you're just saying those two vertebrae are not moving and they're kind of...
the upper cervicals are stuck.
Right.
Good. Now drop higher in the cervical spine and feel the block. Immediate, right? Doesn't want to extend up. It will, but not... So we're looking at 55 degrees of cervical extension. Now, again, are we looking for expansion of each individual vertebrae? Yes, there is a collective sense of extension that we want, but this allows us to isolate where maybe the cervical spine is extending and where it's not. Anybody else want to come feel? Just real quickly, bridge in, push up. So right there, you'll get a nice sense of extension. So really push up, you want to see his neck extend up, so give it a nice push.
Okay.
You'll feel it.
I did already.
Yeah.
Yeah.
It doesn't want to bridge up.
I did.
Mm-hmm.
And it's no surprise when you work in that area with Josh, it's always pretty tight. The upper cervical area is always holding a lot of tension.
Right.
Now, if we take him off the table like we're going to do in a second and check range extension, is he going to be able to achieve good extension range? I'm sure that he will. However, that upper cervical area is still something that's of concern. You feel the difference? Anybody else? Look good? Okay. So, if you would, just scooch where your shoulders are at the edge of the table for me. So, we can take the head off the table, right here. Good. And then we're just going to check extension range. And obviously, we get beyond the 55 that we want. I mean, we get nice extension range in the cervical spine, right? But a lot of it is being driven through his thoracocervical hinge and not so much in his upper cervical. So, if we were going to target an area that could use increased cervical extension, it would be C1, C2, C2, C3, C3. Well, C1, C2 is more rotational joints, but C2, C3, C3, C4, upper cervicals. Okay, and scoot back down.
Is there a less awkward way to try to get them to move up and down? Because some people who are really guarded through the cervical area, it's awkward. The only way that I've been able to do it is like drop the headrest, hold their head, and so some of them are just struggling. I don't know.
Yeah, I mean, you can do something like bolster their back with a
Okay.
couple pillows, and that'll give you enough room to check cervical extension.
Okay.
You certainly can do that. So if
That's the only
have
problem I've had.
how many pillows in here, but that's something that you could do, or you could try going sideline. The problem with sideline is your neck wants to laterally flex. So
Yeah.
we've got to really kind of position it, but you'd still be able to check flexion and extension range sideline.
Okay.
Is always an option. So from there, we go to lateral flexion. Lateral flexion, we're looking at 35 degrees of range. It's not a whole lot. But when you think about it, we shouldn't need a whole lot in lateral flexion. You can also go back to some of the people you've assessed and be like, yeah, there's no way. They don't get 35 degrees. They get to about 20 and that shoulder starts to lift up, or, lateral flexion is typically a very tight. So what we're doing is we're just keeping the head neutral. We don't want it in extension or flexion. We want it relatively neutral. Grabbing the occiput, and we're just sliding lateral. And we're feeling for healthy range. We're also looking for that. So the other shoulder's already starting to pick up a little bit, which is fine. He's beyond that 35. He's at about 45 right now. So we're good. We're going to check the other side. So again, grabbing the occiput, top of the head, sliding. That one pulls that shoulder a lot sooner. So that's a curiosity, right? And that shoulder wants to lift very, very soon. So I'm thinking about, well, what would tie the neck to the shoulder, right? The first assumption would be traps, maybe some scalenes pulling on the rib, we don't really know, but that shoulder really wants to integrate pretty quick. But he can still get nice fluid motion, but something's definitely sticking. All right. Yep, and that brings us to rotation. So what's happening with the shoulder, do you think?
Me?
Yeah.
No,
Do you
pec
have-
minor and scalings.
Pec minor and scalings. So with rotation, we're going back to about the same range we expected with flexion, 70 degrees, which again is a lot to ask for, right? But I mean, he's already almost at 90, right? If we think about here being 0, that would be 90. So our chin is our director. Please make sure you don't do something like this. That is not rotation, guys. The head should be on a centrifugal swivel right through here. It should be the mechanical axis should stay true through the whole cervical spine. So you want to make sure that you are pulling the occiput towards one shoulder and let the chin drop towards the other. So you'll see SCM engaged. That's a proper rotational movement, and we get that. That's about 70 degrees right there, maybe a little bit less, but it's right where it needs to be. But that's a truer assessment than letting the head drop, which is what people will do actively. They'll just drop the chin to the side, but that's not true rotation, right? So we'll check the other side, right? Making sure we keep everything plain. So we're pulling the occiput, right? Make sure you pull that occiput. Don't just let the head drop. Pull the occiput. Allow the head to rotate on a swivel. And again, much easier to get there on this side, much less resistance to the right, but still both. I'm happy with both. I wouldn't be too concerned. The only concern I really have is that upper cervical stiffness through extension. So, and that's about it. Pretty easy, right? So 70, 55, 35, 70. Those are your numbers. Okay? You want to go through active?
So, active is, this would probably be the most